Good day, dear dental students. Good day, dear colleagues. My name is Apakin Alexander. I'm a general dentist and I welcome you on our YouTube Rubberdamology channel. Today I want to show you a new self-training exercise for developing and upgrading your hand skills for rubber dam isolation inside the mouth cavity of your patients during your clinical work. And we discuss polydentia matrix system. And I show you some type of matrices, wedges, rings, and some algorithms to work with this system with the rubber dam isolation. For rubber dam isolation, we're using mid-tone rubber dam plates and accessories like Edelweiss dental floss. First of all, my quick matte Forte kit. Let's discuss what we have inside. Inside this Quick Mat Forte kit we have 6 types of metal matrices. One of them for premolars, light and dark, molars, also 2 types, and for deep margin elevation matrices. 4 types of wedges, interdental wedges, 4 types of interdental wedges, pink, orange, green, and yellow. Also 3 types of branches for rings, small, medium, and large. And as option, you can buy 2 types of rings. One of them is using with forceps, and one of them you can use only with your fingers. I think this is very interesting. For our exercise, we're using anatomical model from MedSkills company. And now we can start to apply rubber dam isolation. Let's decide. We use clamp with wings. This is the clamp from Torbium company. As usually, first of all, start from test position, stable position, and don't forget to check with your finger. This position is very good. Then we must apply 1 rubber dam plate to our metal frame. We're using medium. Apply and fix your rubber dam plate above your finger. Place your top left corner of your metal frame. Small stretch rubber dam plate, also for bottom right, bottom left angle, and then hold the other corner and fix rubber dam to the upper left corner of your metal frame. You must receive such position with the equal space of rubber dam from the left and the right. Nothing exceed material of rubber dam plate at the top of your metal frame, and all material will be at the bottom. Then we test position. You can, if you work with the lateral side of dental arch, we must make perforation not upper than this line, the middle between bottom of the metal frame and the mesial retainers, between them. Very good. Let's start. Choosing big hole in the puncture for molars. We made 2 holes for molars and 2 for premolars. At the x-axis, we use the middle of metal frame, and for right side, choose some right from the center. Choose 46, 47. Then I choose to make perforation from the bottom because it's more comfortable for me, because I did not feel stretch from the rubber dam. It's easier. I made 5 mm between the edge of perforations and made the next perforation. Then I made smaller radius and made additional 2 perforations, also from 5 mm from previous one and last one. It's very good if you made last perforation at the position of your bottom side of metal frame. It's okay. After that, we fix our clamp in the perforation for tooth 47. Stretch rubber dam perforations and put one wing of clamp inside perforations. Stretch perforations for the other wing of this clamp, and now you have 2 wings small above the rubber dam plate and 2 below this. Detach bottom retainers and fix rubber dam in the clamp forceps. Hold this stopper so you can relax your hand. Then put rubber dam and clamp inside the patient mouse or our model. Stretch the clamp and fix it on the model. Very good. Then fix the bottom angles of your rubber dam. Then we must cut dental floss. For this part of work, I like to use probe, sharp therapeutic probe, and release rubber dam from the clamp wings, from the both side. After that, start to invert rubber dam interdental parts. In interdental spaces. Maybe it's easier to make when your model have such fixation of rubber dam. Correct the metal frame position to have more realistic work during your exercises. and finish inverting rubber dam. Now we're ready to talking about polydentia system. Also, we made inversion of rubber dam with the floss. For molar, and then for premolar to 45 and 44. If you're working with subgingival caries, it's very comfortable to work with this inversion of rubber template. Now we choose first type of branches for polydentia ring. This is light blue color for molars. And now decide how we can connect these parts to our ring. First of all, you must detach these parts from holder and receive two individual parts. Then you must connect it with the square holes for the ring, like this. First variant. It's not symmetrical, so you have the big part in the distal position and smaller for mesial position. In some cases, you maybe need the other variant, so you can swap very fast and easy during your clinical work, or maybe your assistant can help you the other variant, and you can choose what is more optimal for your clinical work, this variant or first variant. It depends on anatomical shape of the molar crowns in your clinical case. Sometimes maybe you need combination with the other type of connections for premolars. And you can combine this for two different types. If you have some unusual shape of molars, maybe at the upper jaw, it's more trapezial shape of crowns, in the molars at the upper jaw. For premolars, working with the premolars, it's less variance, but first of all, you need to choose smaller parts. And it's easier to place for premolars. It's more precise connection between matrix, ring, and the tooth shape. For first and the second premolar, the same. But in some cases, we have the smaller crowns, maybe for children or women, and you can combine pink and blue color for making more interesting shapes. Smaller one. It's also stable and very good. But the most interesting part of this matrix system, that matrix branches can also made independently from vestibular side. From vestibular side and the lingual or palatal side. It help to place and adapt matrix in cases when you have abnormal tooth position, crowding. It's also very good for molars in some cases. And of course, very often we have small palatal side and or lingual side and bigger vestibular side. And we can combine pink and blue connectors and place him and have different shape from vestibular and lingual side during our work. What about matrices and the other type of ring? Let's connect the other variant to the second ring. Let's connect branches to our second ring and use them with the forceps. Now you can see the difference. Very compact. the ring for fingers, and ring for forceps. Also very stable position. But it's more interesting to work, of course, with the proper combination. And in this variant, it's more stable. Working with matrices for premolars, after you finish preparation of the cavity in the interdental space, place the matrix. During my work, I very often hold it with the needle holder, like this, and then place ring and release needle holder and matrix. From the vestibular side, we have space for placing interdental wedge. The best choice for premolars is the interdental wedge of pink color. It's very small, but it's soft. And in some cases you could not place it directly without bending this interdental wedge, and maybe with the touch of this part of instrument you feel that it's not fixed very well. Try to swap to the orange. It's bigger and maybe it have more stable position in interdental space between molars and premolars. Maybe for space between first and second premolar, it's better choice to make a pink interdental wedge. And if our patients have periodontal problems or maybe very wide interdental spaces, you can choose the green. If you need wide interdental wedge but you cannot insert it You can also make it smaller, like wood, incidental wedge from wood. You can hold it for smaller place and for raw body of incidental wedge if you need more stable position. Very nice. Now you can see we have three different types of incidental wedges, and also we have the one more bigger than green, it's yellow. But in my case, in my model, I can insert it in any incidental space. It's impossible because the green is also very hard to insert. Now I try to place matrix and ring with my forceps ring in the molar position between 46-47. I remove branches and place light blue color from both sides. Very nice. Remove incidental wedge and place matrix. Matrix for molars, it's bigger. Depend on the curvature of your clinical case and the shape of crowns of molars. You can place matrix with the different sides. My favorite position with the curve shape to the interdental space, to the gingival margin. Maybe you decide to use the other position, but don't forget that lateral parts of matrix may hurt gingival papillars. For this variant, I cut them to have a proper gingival shape. It's more easier to insert. The gingival papillars did not pull it back, and I have time to change my instrument and place ring to this shape. Very good. And also I have space to place incidental wedge of proper color and size I need. I think it's better to place orange in this position. In mouse, I hold incidental wedge from the side perpendicular to the needle holder because it's more comfortable to patient and for my work. It's not hard, it's good size. And also clamp, place clamp fixed very stable. The ring also very stable, and I have good position, so I can adapt matrix distally if I need more more tight contacts. And try to perform 2 restorations at once. During this, first of all, place mesial ring. It's placed more horizontally, and then place the other ring distally, and no problems to place it at once. And you have enough space to work with your material and your modeling instrument with the distal position and distal cavity on the tooth 45 and 46. If maybe you need very fast to build only the wall, distal wall of this tooth from composite, and then repeat this work at the tooth 46, and after you build walls, you don't need all these instruments fixed on the tooth, and you can remove. And after that you have enough space. Also, you can remove this ring not only with fingers, but you can also use forceps if it's more comfortable for you. It's compatible. Let's remove all our instruments from our model and prepare it for the next exercises. I hope you like this small tutorial to choosing matrices, wedges and rings from Polydentia system. If you have any questions, feel free to write it in the comments below. Don't forget to press the like button and share it with your colleagues and friends. Thank you very much.